Hi, this is Dr. George Rogu from RBK Pediatrics. Another month goes by, another student rotates through our office. And today we're going to have student Dr. Sarah Mermelstien talk to us a little bit about common pediatric sports injuries that parents will encounter and you'll bring to the doctor's office for. So she was a wonderful student, learned a lot, acted like a doctor by the end of the month, and was in complete control. So take it away, Dr. Sarah.
All right. Hi, everyone. I'm Sarah. I'm a third-year medical student at NYIT, and my presentation today is about common pediatric sports injuries, and just giving a quick run through of some common injuries that your kids might have and how you can help them before even bringing them to the doctor. So one of the first pretty common injuries that people see are ankle sprains. And one of the things that is very common is if they play soccer or baseball or football or really any running sport, if they roll their ankle, they can come home and complain of pain and swelling. And a lot of times it can turn purple. Sometimes it can turn green. And that isn't necessarily a scary thing. But it is important to come to the doctor and get an x-ray to make sure that it's not fractured. Sprains themselves are from stretching and tearing of the ligaments that hold the joints together. And that's usually where the pain and the swelling comes from. In that picture above is kind of where you would see it. And ways that you can help treat it and also get rid of the pain is rice. A lot of people talk about rice as a very common treatment plan for a lot of overuse injuries. And that constitutes rest, ice, compress, and elevate. So when you have these types of injuries, you want to rest. You want to avoid the running. You want to avoid the sports, anything that causes the pain for at least 3 to 4 weeks or until the doctor clears them. Icing is very important to get rid of the swelling and also the pain. It's important not to put ice packs directly on the skin because it can burn the skin. So use like either a paper towel or even just a hand towel under that, and it can help. Compression. I think most people have seen ACE bandages. If you wrap it, not too tight, but if you wrap around the ankle, it can also help get rid of the swelling and the inflammation in the area, and elevating as well moves the swelling away from the ankle more towards the center of the body and also can alleviate some of the pain. If that stuff doesn't work, you can also use anti-inflammatories like Advil or Motrin, and just make sure you're not overdosing on what the packages say for Advil and Motrin for your kids. So another very common injury is Osgood-Schlatter. So this is more of an overuse injury that happens in kids who are going through growth spurts. And if kids come back and complain of pain right in front of their kneecap, you can see in the bottom right, there's that bump that can also occur on the front of the knee. And that's from repetitive stress on the knee, which causes micro trauma to the epiphysis, which is pretty much the growth plate. And if there's a lot of pulling, it can cause some like small tears and also can lead to some scar tissue, which forms in the area. And that's the bump that you're feeling. It's a very, very common injury, and it's nothing to be worried about. It's again commonly seen in athletes going through a growth spurt. So in boys, it might be a little bit older, like 12 to 15. In girls, it might be a little bit younger, like 8 to 12. And if this does happen, again, it's nothing to be worried about, but ways that you can help treat the pain is, again, using a very similar rice technique. You want to rest. You want to abstain from the sport that causes the pain. Again, use Advil or Motrin to help get rid of the swelling and the pain. Ice is also, again, very important because these overuse injuries are from a bunch of trauma, which can cause inflammation. And again, ice is very, very good for that. You want to do it several times a day, and that's the way that it actually will get rid of the inflammation. Stretching is also very important in this injury because a lot of times it is just from the pulling. So if you were stretching the quads and the hamstrings every single day, obviously, if they're having pain, don't do that. But if they can tolerate it, stretching can help also not only like relieve the pain they're having now, but it can prevent this injury from returning. And top, there is a picture of a patella strap, which are also very common. You can get them at CVS, Target, but they're just straps that you can put around the front of the knee. And they also help decrease the pulling of the tendon because it kind of sits right on that part that's stretching and can also help. Some people think that it does, some people don't, but it's always okay to try it. Why not? So another very common injury are shin splints. A lot of people complain of pain in the front of their leg, and it's usually on the inside, but it also can be on the outside. And most of the time they'll come home from running sports like soccer, track, lacrosse, all of those things, and they'll complain that their shin hurts. It hurts to the touch a lot of times, and also hurts from if they stretch it, or even if they overuse trying to lift their foot up. And the symptoms for this, very similar. They include pain and swelling. Sometimes they describe this pain as throbbing. And this is also, again, an overuse injury. It comes from small tears in the muscles that attach to your shin bone. And that, again, can cause inflammation, pain, and that's what they're complaining of. Ways to treat shin splints, again, are very similar. So you, again, want to abstain from the sports where the pain has come from. And another way of icing for these injuries is called ice cupping. So there's a picture on the screen, and if you take a small paper Dixie cup and you fill it with water, at least halfway, and put it into the freezer, freeze it, and then take it out, and you can rip off the top and keep the bottom, and put a towel under the leg and use the ice, and kind of it melts as you're icing your leg. And it really helps get rid of the inflammation, and you can kind of like press down and massage it in as well. And that really helps get rid of the inflammation and the pain and all of that. And again, anti-inflammatories like Advil and Motrin are also very good. Common causes for this type of injury are actually from sneakers being too worn out. A lot of people use their sneakers, me included, for way longer than you're supposed to. You're actually supposed to get new running sneakers and even cleats every 6 months. And a lot of people don't do that, and that can cause shin splints. So another way to, mitigate this from happening again, if it does happen in your kid, is to make sure that you're getting new sneakers that fit them properly. So another one of these common pediatric injuries is called Little League elbow. If your child is a pitcher and they throw a lot in Little League or even in competitive baseball, they can complain of pain on the inner side of their elbow. And again, this is traditionally in kids who are growing because it's another injury of the growth plate. And it comes from repetitive throwing motions on that growth plate and puts a little stress on it, which then causes, again, pain and swelling. It can either come with a complaint of sudden pop, they might feel it when they're throwing, or it can just happen gradually over time and they feel like it's pulling. So again, this is very commonly found in 18 to 15-year-old boys who play baseball and who are pitchers. And again, like, it can happen if they pitch too many times in one game. It can happen if they pitch too many times over a certain amount of time. So it's important for the kids to listen to their bodies and communicate with you and also their coaches to make sure that they're not overworking themselves. And ways, again, to help with Little League elbow is to rest. This one especially, since it is directly on the growth plate, you want to abstain from the sport for at least 4 to 6 weeks. And icing is very important for this as well, because there's a lot of inflammation in that area, and the growth plate is a very sensitive spot. And using Advil and Motrin to help reduce the pain and the swelling is also very important. For these injuries, when they do start coming back, you want to do physical therapy and strengthen the muscles around the elbow to take pressure off the growth plate. If you start just going right off the bat back to pitching, they can have this injury repeat itself and it can become chronic. It's very important that they do rest, and when they do come back, it's a gradual return, and they start doing exercises to strengthen all of the muscles around the elbow so that it doesn't come back.
Mhm.
Another very common injury is a distal radial fracture. These types of fractures happen when kids fall on an outstretched arm. It doesn't have to be from sports. It could even just be on the playground and really anything. So if your kid comes home and saying like, oh, I fell on my arm, I'm having pain in my wrist, it's important to come to the doctor and get an x-ray, because this is something that we want to rule out before treating conservatively. So kids might come home and say they have some wrist pain, some swelling, and sometimes if it's really bad, you might see a deformity. But it is, again, important to come into the doctor if they do have any of these pains so that they can get an x-ray and make sure that we treat this appropriately. And so ways for treating this are casting. A lot of people have seen these casts before, and kids might not like it so much, but it's very important that we immobilize these. A lot of these fractures tend to happen in the growth plate, very similar to the other injuries that were in the growth plate in kids who are growing. So it's very important that you give it the time and the space to heal. In some cases, if it is a little bit displaced, you might have to get surgery, or the kids might have to get surgery. So it's important that they follow up with an orthopedist, and your general pediatrician will tell you if that is something that they want you to do. And very similar to the last injury, once you are out of the cast, it is important that you start moving slowly back into the sport. Physical therapy is definitely indicated in these cases because their wrist has been stabilized and not moving for about 2 to 3 weeks, and coming straight out of the cast and starting to do their sport again can cause another injury. So coming out of the cast and starting physical therapy and strengthening the muscles in the wrists is very important in this injury. Another very common injury are finger and toe fractures. A lot of kids tend to stub their toes or jam their fingers, and sometimes it ends up looking like that bruise. And they can be very tiny fractures that can make the foot look like that. And again, it's important to come into the doctor so that they can diagnose it via an x-ray. And you might see, like, again, the bruising in that picture, some swelling. It's going to be pretty tender to the touch. And sometimes if they stub it bad enough, you might see an obvious deformity as well. And in these cases, buddy taping is how we treat them. Resting, again, for these injuries for 3 to 4 weeks is very important, and the doctor will buddy tape for them. You will get a roll of tape as well, and you can just tape them. Usually you can change it depending how many times, if they shower every day or not. Just change the tape to make sure that it's dry and also pretty tight around the toe or the finger to make sure that it is stabilized. And for these as well, there's a lot of inflammation, a lot of pain that can go with it. So icing multiple times a day is also very important. And Advil or Motrin if needed for the pain as well. And one of the last injuries I'm going to talk about is a pretty important injury because it can cause some serious problems in the future if not dealt with appropriately. And those are concussions. If your kid has ever gotten hit in the head by a ball or ran into somebody or even just gotten whiplash and says that their neck hurts, it's important to come to the doctor so that we can check the kid out, make sure that they don't have a concussion, because if they do, they need to go through a very strict protocol on how they are allowed to return to sport and how they're allowed to even return to the classroom. The brain, especially in kids, is still developing. So concussions repeatedly, one after another, if they go back too quickly into sport, can be very dangerous for their brain development. And the concussion is caused by your brain rocking back and forth in your head from either hitting it, or even the whiplash can cause it to pretty much bounce, and it can hit either the front or the back of the skull. And the symptoms that kids complain of are usually dizziness, confusion. They might have some changes in coordination, may feel a little bit off balance. They might seem a little bit more tired than usual. Some of them are nauseous and they end up vomiting. And also a sign that you can look at their pupils. Sometimes one of their pupils is small and one of them is big. If you see any of these symptoms, it is very important to call the doctor and make sure that the kid is seen. And they usually diagnose these more of a clinical diagnosis by memory, coordination, concentration, and reflex tests. And the doctor will evaluate them and make sure that if they do have a concussion, we use a very strict protocol. So for treating concussions, most of the symptoms in kids, they tend to heal pretty well, and they'll say that they feel better in a couple of weeks, but it is very important that you still avoid them until the doctor clears them. Just because kids tend to feel better doesn't necessarily mean they are fully healed. And for an injury like this, it's pretty important to make sure that their brain develops properly. And there are new protocols for returning to sport now. You must have completed an exam with the doctor to make sure that they clear you. You also have to be able to go back to school first, be able to sit in class and take an exam without any issues. You also have to have no symptoms, and you have to be not taking any medication for the pain that subsides the symptoms. And the doctors will decide if they're ready or not, if they are back to their baseline on the cognitive and the physical exams that they did when they first diagnosed them. Some of the issues that can cause more symptoms and also make the concussion longer is by being on their phone, being on the TV, which is hard for kids because they love playing video games, love being on their phones, but it's very important to either completely avoid or try and cut down on screen time. The bright lights and the blue light in screens are not good for the healing of the brain. If your kid is of driving age, it's important that they avoid driving. Their brain is not fully healed, and it's not safe for themselves. It's not safe for anyone else on the road. So until the doctor tells them they are allowed to be driving, avoid that. It's also very important for healing in any of these injuries, actually, but especially in this one, that they get plenty of sleep. Kids heal very well when they have a lot of sleep. And also, especially for the brain, even taking a couple naps a day, if they have a concussion, is very good in the healing for their brain. And like I said, for this injury, it's very, very important that they have a slow return to activities, and it has to be using the doctor's guidance. You don't want your kid to go back too soon, to get hit in the head again, and then have to revert back to all of these protocols again. So it's very important to listen to your doctor and not let your kid go back to sports until they are fully cleared. All right, well, that is the end of my presentation. I hope this was a little bit helpful for you guys and can take a little bit of stress off if your kid is complaining of injuries, so you know how to, one, make them feel better, and two, help you know when to go to the doctor and when not to.
Thank you, Sarah, Dr. Sarah. It was a pleasure having you in the office at RBK Pediatrics. I hope you learned some general pediatric medicine. And we saw a lot of these cases during the month that you rotated with us. So good luck to you in the future. And I'm sure you're going to make a fine physician, whatever field you choose.
Thank you so much.